Welcome to AITV News. COVID-19 vaccine guidance has changed, and you might be wondering, will you still be able to get a shot? Here's what we know.
The main development: COVID-19 vaccine recommendations have been updated. On Tuesday, May 28, 2025, Health and Human Services Secretary Robert F. Kennedy Jr. announced that COVID-19 shots are no longer recommended for healthy children or healthy pregnant women. In a social media video, he stated vaccine was removed from the Centers for Disease Control and Prevention's, or CDC's, recommended schedule for these groups. So, who is the vaccine still recommended for? It's understood to still be advised for children or pregnant women with specific existing health conditions. This aligns with an FDA announcement from last week, stating the vaccine should be offered to those over 65 and individuals aged 6 months to 64 years with underlying health conditions. Secretary Kennedy made the announcement alongside National Institutes of Health Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Martin A. Makary. Notably, no CDC officials were present in the video.
This new policy quickly sparked concern, with many medical experts expressing strong disagreement. For instance, the American College of Obstetricians and Gynecologists reaffirmed their recommendation that pregnant patients should receive the COVID vaccine, highlighting the increased risks viruses like COVID pose to both mother and fetus. Dr. Amesh Adalja of Johns Hopkins described the decision not to recommend it for pregnant women as dangerous. Studies indicate current vaccines are safe and effective for these groups and can offer protection to newborns. Adding to the confusion, CDC officials were reportedly caught off guard by the announcement, allegedly receiving only a brief informal notice shortly before it was made public. As of Wednesday morning, May 29th, the CDC's own website continued to recommend the vaccine for everyone aged 6 months and older, including pregnant individuals. Further complicating the picture, FDA Commissioner Dr. Martin Makary, who was present at Secretary Kennedy's announcement, had co-authored an article just a week earlier stating that pregnancy increases the risk from COVID-19, though he also stated the data on boosters for pregnant women was mixed.
The decision also bypassed the CDC's customary advisory panel review process. This panel, the Advisory Committee on Immunization Practices, was scheduled to meet in June, but the announcement was made before their planned discussion. Dr. Tina Tan of the Infectious Diseases Society of America voiced concern over a major policy change like this being made unilaterally, questioning the decision-making process. What does this mean for accessing the vaccine? For healthy children and pregnant women, availability is now uncertain. A significant concern is insurance coverage. Will programs like Medicare and Medicaid continue to cover vaccines not officially recommended by the CDC for these groups? The Affordable Care Act typically mandates that insurers cover CDC-recommended vaccines without out-of-pocket costs for patients, but this new policy could impact that. If coverage is affected, individuals choosing to get vaccinated might have to pay themselves. Dr. Paul Offit warned this could render vaccines uninsurable for these groups and restrict patient choice.
For others, specifically people over 65 and those aged 6 months to 64 years with underlying health conditions, the vaccine remains recommended by the FDA. This policy shift comes as reports emerge of a new COVID variant, NB181, causing a surge in cases in parts of Asia. Health experts express concern that this new directive could limit vaccine access and hamper preparedness for emerging variants. While a few U.S. cases of NB181 have been identified, its prevalence here is currently low.
In summary, advice on COVID-19 vaccinations has shifted, with shots no longer recommended for healthy children and pregnant women. This decision has drawn disagreement from medical organizations and created confusion regarding the decision-making process, the CDC's involvement, and future vaccine access. particularly concerning insurance coverage. Coupled with the emergence of new variants, many questions persist about the potential impacts on public health and individual choices. AITV News will continue to follow this story.